Gentlemen, let me ask you this. Have you ever wondered why, no matter how much effort you put in, she doesn't quite reach the peak you were hoping for? You might be doing all the right things, yet missing the one secret that takes her from that felt nice to my entire body just melted. Well, today I'm going to give you that secret. It's not a toy, it's not a pill, and it's not some complicated move you need hours to learn. It's a simple, science-backed method that once you understand it, can give her the kind of explosive, trembling, unforgettable orgasms that make her look at you like you're the only man in the room. And here's the best part. It's not about magic hands or being born with natural talent. It's about understanding her body, her biology, and pacing yourself in a way most men never do. I'm Dr. Narita, a urologist with 12 years of experience helping men improve their performance, confidence, and intimacy. And today, I'm going to break this down step by step. Before we dive in, quick question for you. Where are you watching from? I love seeing the community of men over 40, 50, and 60 watching from all over the world. Drop your city in the comments. And while you're down there, go ahead and hit the like button and subscribe if you're ready to learn how to become the kind of man women brag about behind closed doors. Here's the lie you've probably been told: that oral sex is all about technique or speed. That if you just do what you've seen in movies or heard in locker room talk, you'll automatically make her climax. But here's the truth no one tells you. Most women need time, rhythm, and anticipation far more than flashy tricks. Their bodies are wired differently than ours. Where men often respond quickly to direct stimulation, women's arousal builds in layers. If you rush, you short-circuit the process. If you go steady and use patience, that's when fireworks happen. And the single most effective tool to unlock those fireworks is something called the start-stop method, sometimes called edging. Done properly during oral, it builds waves of arousal that explode into the kind of release most women rarely experience. Now, how do I know this works? Because I've seen it firsthand, both in research and in practice. Over my 12 years as a urologist, I've guided countless men, some in their 30 seconds, others in their 70 seconds, who felt lost when it came to intimacy. They thought age had dulled their ability to satisfy a partner. But once they learned the pacing and patience behind this method, they not only gave their partners more pleasure, they rebuilt their own confidence in the bedroom. One of my patients, let's call him Robert, 64 years old, came to me after years of frustration. He said, "Dr. Narita, I try, I really do, but she either gets bored or I burn out before she gets there." Within 2 months of adjusting his approach using the start-stop method, he was glowing. His wife told him it was the best intimacy they'd had in decades. That's why I can say with absolute confidence, this is not theory. This works. So let's go step by step. Think of this as a countdown to mastery. 3 pillars that transform your oral game from average to unforgettable. Step 1, set the stage for comfort. If you can't breathe easily, if your jaw aches after 3 minutes, or if she's twisted in a position that feels awkward, guess what? Neither of you will last long enough for real magic to happen. Biologically, arousal is like climbing a hill. If the climber keeps slipping because the ground is shaky, she never reaches the peak. Comfort for both of you creates steady footing. Practical tips. Pillow under her hips. This tilts the pelvis, giving you better access and increasing sensitivity. Support yourself. If you're kneeling, put a cushion under your knees. If the bed's too high, angle her near the edge so you can sit in a chair. Relax your jaw, keep it loose, breathe through your nose and settle in. This isn't a sprint, it's a marathon. Emotionally, when she sees you're comfortable and in control, she relaxes. And relaxation is the fuel of arousal. Step 2, the patient buildup. Here's where most men blow it. Literally, they rush straight to the clitoris, hammering away like it's a button to press. But biologically, the clitoris has over 8,000 nerve endings, the most concentrated in the human body. Too much, too soon. It's overwhelming, even painful. Instead, you build up. Thin. Of it like warming up an engine. The more gradual the heat, the smoother and stronger the performance. How to do it? Start away from the clitoris. Kiss, lick, and tease the inner thighs. This area is packed with nerve endings that prime her body. Circle outward in soft kisses and licks around the labia. Slow and teasing. Introduce rhythm. Gentle, consistent strokes with the tip of your tongue, bottom to top. Count your strokes if you need to. Slow and steady. Emotionally, this buildup tells her, I'm not in a rush. I want to savor you. And that's incredibly arousing. Practically, this also buys you time. You're not straining. You're in control. Step 3, the start-stop secret. This is where the fireworks happen. The start-stop method is about bringing her to the edge, then pulling back, then building again. Each cycle compounds her arousal. So when she finally does climax, it's not just strong, it's earth-shaking. Biologically, edging allows her nervous system to build higher levels of arousal with each wave. Blood flow increases, muscle tension grows, sensitivity peaks. Emotionally, the anticipation drives her wild. It's the difference between sipping a glass of water and waiting until you're parched before drinking. That release becomes unforgettable. How to time it. Watch for cues. Breath quickening, thighs clamping, belly tightening, hands gripping. Right before she crosses the line, ease off. Switch to kissing her thighs, her belly, or whispering something warm in her ear. Let her settle 20 to 30 seconds. Then resume the exact same pattern that got her there. Do this 2 to 3 times. On the final build, don't change anything. Stay steady and let her go over the edge. Practical tip, use your hands. Gently spread the labia. Add light suction on the clitoral hood or anchor a fingertip inside while maintaining oral rhythm. And always check in subtly, more or less here or higher. A 5-word check-in keeps her safe, engaged, and open. So, how do you put this into practice? Set up for comfort. Next time, arrange pillows, breathe easy, and make sure you can last. Pace yourself. Spend twice as long on build-up as you think you should. Remember, anticipation is arousal. Edge her. Bring her close. Stop. Let her breathe. Then build again. Repeat 2 to 3 cycles before carrying her over. If you follow these 3 steps, you'll transform from a man who tries to a man who delivers. Now, some of you might be thinking, Dr. Narita, I'm too old for this. My stamina isn't what it used to be. Let me tell you, age is not the end of your ability to give pleasure. In fact, many women say that men over 50 or 60 make the best lovers because they've learned patience. They're not in a hurry. They care more about the experience than racing to the finish line. Emotionally, that makes women feel desired, cherished, and safe. And biologically, with proper pacing, you don't need the stamina of a 25-year-old. You need consistency. And consistency is ageless. G. Gentlemen, here's the truth. You don't need to reinvent yourself. You don't need to be younger, richer, or stronger. You just need to understand her body, respect the process, and give her the patience she craves. The start-stop method isn't just about technique. It's about presence, about showing her you're a man who listens, who notices, who's confident enough not to rush. So tonight or the next time you're intimate, try it. Set the stage, build slowly, edge her twice. Then let her release. Watch what happens, not just in her body, but in the way she looks at you afterward. That's when you'll know you've given her something rare. If you found this helpful, hit like, subscribe, and comment. Stop below so I know you're ready to take your intimacy to the next level. And tell me, what's one thing you wish you'd learned about women's pleasure 20 years ago? Remember, you're not too old, you're not past your prime. With small changes, you can create comfort, confidence, and connection that lasts a lifetime. I'm Dr. Narita, and I'll see you in the next